I know that it's my time to shine. Don't need
It's Ivy Slater, and you're listening to Her Success Story podcast, a show where gutsy businesswomen share their success journey. Hi, this is Ivy Slater, and welcome to today's episode of Her Success Story. I am very excited, if you're just joining us, to share that we are in the middle of a series. We're in a series around women leaders in the field of technology. This has been really important. It's been passionate. I've been really passionate about it. I'm not going to tell you I haven't been. If you missed the intro session, that's fine. Don't worry about it. But here's the short of it. A couple of years ago, we went to do this, and I reached out to every network, LinkedIn, all my past podcast guests for 7-8 years, et cetera, and we got 2 guests. And when I said to my team, let's do a series on women in technology, and they're like, Ivy, we couldn't fill that well last time. And I'm like, that was then, this is now, and this is why we keep showing up. So today I'm thrilled to tell you we have a full, abundant series with amazing leaders who've done a variety of different things in technology. And I'm thrilled to introduce you to today, Victoria Strickland is the director of PwC's Health Industries Advisory Practice, where she has spent the last 14 years helping some of nation's largest healthcare organizations navigate complex business and technology transformations. She was also recognized by Women We Admire as one of the rising star of women leaders in the healthcare industry in 2025. So, listeners, we are making waves in technology. We are getting women leaders to come out and speak and share their stories. And Victoria, I had the honor and pleasure to meet through another colleague, see her on a panel and say, oh my goodness, let's keep talking. So Victoria, thank you for joining me here today.
Ivy, I'm so glad to be here. I know that was a mouthful around technology, just buzzwords right and left. But I'm just so glad that our paths were able to cross organically. As Ivy mentioned, we met at another panel that talked about women in tech for a startup about a month ago. So I'm just so glad to be sitting here with you on this podcast.
So I always, my first question is, what drove you to not just the field of tech, but technology and tech and healthcare? Because I'm going to say one of the first people I've interviewed in healthcare technology, and I find it fascinating.
It is a little nuanced. So usually I'm sure when you think of healthcare, you don't think of a tech savvy business, that's for sure. And there are many reasons why. But tech is the backbone of so many industries, so many legacy industries, finance, retail, healthcare, government, business, and there was no way to avoid it. Now, was it front of mind for me when I first started my career about 15 plus years ago? Definitely not. Did not know how to code, did not wanted to stay far away from engineering. My passion was being in the medical field through lived experiences with my family, being, there for relatives that were trying to navigate the healthcare field, and it was not easy.
It is not easy.
It is not easy, and it still is not to this day. And
Yeah.
there's no way that we can, subside or express that it is getting easier because it is real, people's pain out there and real lives and issues that are occurring. But I am in the field because I know there's an inherent need to be in the field of healthcare. It is a industry that is deals with some of the most vulnerable people in our population. And the beauty that I've seen over the last 15 years is the way that we have driven more technology and innovation into an industry that has been longing for that for years. So that is why we are here on this podcast talking about not only healthcare, but technology.
So I'm going to take it down really simple to start. So when we think about technology and we think about healthcare, where do we see we think about all the integration of software platforms and things like that. I think about the machinery, right, used in healthcare. Where is your focus? Where's your sweet spot fit in?
So I work with both the national, regional, state-based insurers. And also I know there's a reaction to insurers because we
Somebody's got to be for them.
there
In
for
order to
justified
create
reasons,
change, we have to be in the game.
you have to be in the middle of it. So where you see technology with a lot of insurance areas spans the gamut. It is highly administrative. The fees that you see on your co-payments or your premiums, those are paying insurers, not only hospitals and physicians.
Yeah.
And the thing that is central to what we see in the payer space is how do we drive down administrative cost? So there are a lot of opportunities around operational efficiency, and that's one area you see technology being inserted. Not only large platforms like your enterprise resource planning or claims platforms, but it's also looking at AI, and I know we'll have some time to talk about AI. But what you also see is there are high regulatory pressures for insurers for justified reasons. And so instead of looking at, your traditional fee for service model and how many services is a patient consuming, it's now around what's the value that the patient is receiving on their care. And is the value of care resulting in higher quality and better outcomes for the patient? And that's where it really gets unique around technology and interesting, because then you start to see more around predictive analytics,
Right.
data aggregation, better navigation of a care journey for a member. And those are just that level of change is very impactful for the patient. And I think that's the type of technology that really thrills me the most is how do we make sure that we're giving the right healthcare with the right outcomes at the right time for members.
How do you begin to start figuring that out? Like my brain is going in so many directions. And Victoria and I were both laughing that we're both kind of like those New Yorkers who you're going to see a bunch of our hands moving as we talk. And it
I'm
just,
sitting on mine purposefully. So
oh, give it up. Join me in the hand movement club. Uh, but where, like, you have the patient care and then you have these big massive companies, and I'm so impressed because you work with the big massive companies
Mhm.
to create what is like big massive companies, but big insurers to what was my mom in the day, our families, the people we know.
Yeah. It's it's thrilling because while you have your traditional large healthcare platforms, and I won't name any because I don't want to,
Nope.
but everyone's familiar with some of the larger names out there. There are a lot of new entrants. There are companies, so you have your 30, 40-year-old health, platform companies out there that it's their bread and butter in terms of the type of services they provide, hospitals and insurers. But now with technology and anyone really being able to write their own code, develop Python code, create their own websites, it's creating incredible new avenues for other companies to come in and specialize in more niche services that are really driving the quality and outcomes of care. And that's what's so thrilling about it. You blink and 10 more companies are out there trying to eat the lunch of some of the larger companies.
Yeah.
And so that level of ingenuity and pace, in addition to a lot of the regulatory change that's always coming down the pike, there is no way that anyone can sit on the sideline and wait for, technology to happen to them. So a lot of our clients are actually asking and looking for what's the level of ingenuity that I can think about when I'm thinking of my growth strategy in the next 5, 10, 15 years? What are some of the organic growth plays I can think of when we're talking about introducing new capabilities or, new platforms? What are some of the inorganic growth opportunities when we're talking about acquiring different platforms or even health plans, so that we are able to expand our data, our outreach, and access to members. So there are so many different ways that you can enter the technology space for these clients, and have the patient and quality be at the center of all of the different strategies that you roll out.
So I hear the passion in your voice, and I love that. I absolutely love that. Um, how did you find yourself on this path?
I will say it happened very organically. So I actually, as I mentioned, started 15 years. I always knew I wanted to be in healthcare, but I didn't know to what
Okay.
capacity. So, as some are, I was pre-med for the first couple of years. Took a few classes that I said, "Oh, I don't know if this is the route." It might have been
I know a
physical
few people that
chemistry.
happen to.
Yeah, it's interesting. It's a shared experience. And then I ended up working for a large health plan in DC, Maryland, Virginia area, and I helped with
Okay.
their community benefits. So basically, to be a tax exempt health plan, you have to demonstrate what is it that you're doing in the community every year to improve access to your constituents. So
Okay.
it's around community sponsored events. It's around Safe Needle Act and other things that you might be considering. It's around increasing, access and nurses and bed access to certain more destitute areas. Um, but in doing that community benefits assessment that summer, it gave me a new perspective of how to approach and interact with healthcare that was very unique. And it didn't necessarily require me to be in the hospital. While I truly respect those individuals, I saw other avenues to sort of rewrite healthcare.
Hmm.
So that is when I shifted and looked at, consulting and how corporations consider healthcare and what are some of the strategies that they are doing and the work that they're doing. And it's anything from supporting mergers and acquisitions of hospitals to writing strategies of some of your largest um, payers and insurers to, maybe implementing an ERP system at your local hospital. There's so many different ways to get involved. And so I got involved. I loved the people I worked with. I saw a lot of people who were both mentors and sponsors throughout my career, and
Nice.
that's a
I
very
love that you just
unique
said that because
difference.
that matters. That
Yeah.
really matters. It makes a difference.
It really does. And I know you already know, Ivy, but there is a unique, it might seem small, but there's a nuance to a mentor versus a sponsor,
Let's talk
and
about that for a second, like that unique difference, because it's like fine, it's a fine needle.
mhm, it really is. I think that, those that you seek advice from and those who you find as part of your counsel, and those are your mentors. Those are people that, you can turn to and have lived experiences and can help you make informed decisions on your career. Sponsors are those that are more so advocates for you. There's a level of accountability. They might put themselves on the line a little bit to help move you forward. And I think those are the people who have access to the rooms that you don't even know exist, who are able to advocate for you in rooms and in conversations that you are not physically there for. And so by having that in your career and having that at your job, it makes things feel, it creates a trust, it creates a support system, and it allows you to learn an environment that um, it just allows you to feel safe.
Yeah.
It's a very safe space. So I think that the reason I've stayed at the firm or in my career as long as I have, and doing the work that I've done, is because I have had so many people open doors and support me and trust me in very high stakes situations. And through that, I've been able to build my own curiosity and my own perspectives and my own platform and do the same for others. And I think that's where it makes a difference between having a job and having a career.
So you said you've had sponsors. How has that helped you? So obviously it did, because this is what we're talking about. But the question is, I want to get into a little bit more of the nuance, a little deeper, as being a woman in the field of technology. I'm sorry to say it, but the demographics are the demographics. There are just more men in technology than there are women. That's why there's huge movements to get more women involved. What were you facing and how did you navigate it to advance your career as significantly as you have? Becoming a director of PwC is nothing to sneeze at by any means.
It's been a feat. Yes, I think that, so to your point, the numbers are not um they are not something to feel inspired about at the current moment. This is why these platforms and this podcast is so important. Really appreciate you having this. I think the most recent numbers were showing that 50% of women who enter tech leave by age of 35 or midway through their careers. Those who are executives at tech companies, only 25% of those executives are women. However, when we're looking at things like AI and many of the platforms that are pushing um, pushing more automation,
Right.
representation is more important than ever right now. It requires a diverse group of people to be at the helm of ideating, building, governing, adopting AI, and it will be detrimental if we do not have women at the table at the rate that is required. And so we need to continue driving and inspiring women and knowing that, it is not a field. I used to joke about, your competitive advantage going into tech might be learning how to be a COBOL coder because so many of your government and retail and financial systems, including healthcare systems, are written in COBOL. That is a
Right.
50-plus-year-old, language model. That is not the case anymore. What we need are not, we still need programmers and engineers, but we need strategists, we need architects, we need designers, we need change agents. Um, Women are so important and foundational to all of those areas. And we have to make sure their voices, their perspectives, their unique opinions are represented in the tech field more than ever. So,
It's so true because men and women think we sometimes think and process differently. We see
correct,
things from various points of view that is so helpful, is so helpful in the long run.
correct. It's very helpful. And I think the reason the, the sponsors for me have been not only women, but I will say predominantly men, quite frankly. And
I
it's
love it.
because men have access to some of the rooms that many women do not have access to. No matter how unfortunate that sounds, that is our reality at the current moment. And many of them have also, put themselves on the line to support me. And I think the reason that you and I are even speaking today is because I had a sponsor support me with joining the panel of our dear friend a month ago. And so, just by sheer fact of having someone who trusts you and advocates for you, and opens those doors for you, like you have to walk in.
You
So no
have to
one's going to
walk in.
walk
The
on your
door could be
behalf.
cracked, but you have to take that step. It's
Correct.
so vital.
Correct. But knowing that you are in that room for a reason and you are being discussed for a reason and someone is seeing that potential in you, it is paramount that as women, we don't shy away from that.
So, what has surprised you in your journey?
Maybe that I've been at the same company for 15 years. Well,
Have you
yes,
seen a lot of your peers and colleagues jump?
there has been quite a bit of movement, and I think that's also a unique area right now, as well. I would say, I would, uh, you know, when you're looking at how you evolve in your career, it is okay to evolve differently than, your current company or your current circumstance. Like that continuous change, one thing we know is certain is change. So that continuous
Yeah.
change is healthy. And it's important to be able to step outside yourself. And if you're challenging yourself, you're going to be uncomfortable. I think it's very important to be
It's a
uncomfortable.
given.
It's a given. And so I think what has inspired me over the years is knowing that while I have been in the same industry every single year, every single month, every single week, I am uncomfortable in some type of situation. And that shows a level of being able to continue to grow, to push myself, to navigate new waters. And I think through that level of change that I've experienced throughout my career, whether it's at the same firm or other places, is something that's so invaluable. So I do have a lot of peers that have moved across different industries and different areas. I have quite a few friends in tech, and you know, it they what is great is they are all growing at their own rates, and it's
Yeah.
inspiring to have conversations with them when they're talking, about working at a large tech company or creating a startup of 10 plus people, or deciding to go in-house to a large company that is also driving their tech strategy. Like there's so many different ways to get involved, but I think at the end of the day, they're all seeking growth. And that's the beauty of, I think the world that we're living in, because everything is changing so rapidly.
I think the world, yes, technology is on a rapid path of change, a rapid, rapid path of
Mhm.
change. And, for me, I'm a firm believer of leaning in, to change. I've been in business I hate to say this, a long, long time. Between Slater's success and owning my printing company, I've been a business owner way over 30 years. And the one thing I can promise you is there will be change. When the internet came around and everybody thought everything was going to blow up, it just shifted, it changed, and it stayed. Right. And I think we're at that next intersection point, or
Yes, we are.
inflection point, is better said. And there's an expression that goes, excuse me, there's a great expression, it's the name of a book, that says, change is good, comma, you go first.
Yes.
Uh,
Yes.
because change is scary. And we have to put on that big girls, what, ladies, and continue to step into it.
Exactly. And we
So
have to weigh risk, right? We like change at 20 looks very different than change at 30 and change at 50. Like and the circumstances around you. And so I think that it is in an area that is um, predominantly led by men. What we're seeing is there is more demand for flexibility. There is more demand for understanding that, there is a lot of meaningful work out there that requires very diverse thinking and very diverse experiences. And so not only do people need to change, but companies have to change. And I think that's the beauty of what we're seeing right now.
So, if I can ask you to share one tip or piece of advice to a woman who's in the field of technology, or just in any field that you feel that you're growing and you're committed, and this is where you're anchoring your career and you're looking to grow it, what would that piece of advice be for them?
I would say, in addition to sponsorship, which is truly, I can't emphasize it enough, it is so important to make sure that you have people that advocate for you and that see you. Um, Not every company can afford that and or prioritizes that. And I think that is a very strong indicator of how much a company invests in you, because just remember, it is always bi-directional. Um, so finding a sponsor or sponsors is paramount. But in addition, I think the biggest thing is that I know I experience is making sure that I understand why I'm in the room, um, and feeling empowered to be curious, always be curious. Imposter syndrome never goes away, at least for me. If it does for other,
I'm going to
please tell me
say
the secret.
imposter syndrome is, to me, it's not supposed to go away if we're playing a big game.
That is, yes.
Because if we're continuing to push ourselves and if we're continuing to commit to being out of our comfort zone, then I can't tell you how many times I'll turn my head and say, who are they speaking to behind? Who is that? They can't be me.
Mhm.
And I question with a big question mark, yet it is. So
Yes,
that's important.
it is very important. And with the way that you said it is perfect, don't shy away from it. It is a part of our natural being and fiber. And I think the biggest thing is making sure that if you're in the room and when you're in the room, not if, but when,
Thank
know
you.
you're supposed to be there. And I will say over my career, what I've learned is many a times I am the only woman in the room, the only
Mhm.
Black woman in the room, sometimes the youngest in the room. And feeling comfortable with that has taken quite a bit of time, quite a bit of mental capacity. And knowing that I don't have to have every answer, but what the answers that I do have, I feel confident and strong about it because I was brought in the room to answer those questions. So I think
And
being
we must speak up. We're in
must
the
speak up.
room, we must speak up. We're being brought into rooms. If we want to be invited back, we need to share our voice, share our thoughts, share our point of view, value why we were invited or fought to get a seat. Because we're not always
1000%.
invited. Sometimes it takes a little fighting to get that seat.
Yes. There was a women's panel that we had at our firm a couple years ago, but it was said perfectly that a female colleague mentioned that she spends so much time waiting for the perfect moment to speak up and state her claim. And the moment is so fleeting,
Mhm.
and we cannot wait for that perfect moment because our counterparts don't wait for that perfect moment.
Nope.
Do it with poise, class, confidence, like, but never hesitate to speak up
Yeah, I love
because
that.
we're brought in the room to do that. So,
I love that. Victoria, I can't thank you enough for joining us here today on her success story, for sharing your journey, sharing your truly the shine that you bring to this. Truly, truly the shine you bring to this. And that is so important. You could see how much you love and are committed to what you do and how much you care about it. And for making room for yourself and the next many women to come with you. I very much appreciate you talking about sponsorship. And ladies, gentlemen, if you don't have one, go seek one. Get a mentor, get a sponsor. It matters. You don't have to be here alone. What I love to say at this point in the show is taking a deep breath in. It's a beautiful gift in grounding yourself. And think about you put some time and energy into listening to the conversation between Victoria and myself. If you put the time and energy into that conversation, identify one takeaway from this. What was the piece that you took away? Jot that down somewhere. I don't care if it's a piece of paper, if it's a phone, it doesn't matter. From that takeaway, identify your action. What is your action step? Is it going to be to go get a sponsor, to research more about sponsorship, to check out what technology is, to check out the healthcare world? Whatever that is, take the action. My biggest joy and greatest gift here is if we show up together every week with our success story, and every week we identify an action we can take, we will all move forward together. as a community, and that's the golden piece. So I hope you continue to join us on her success story. If this interview was helpful for you, share it forward to other people it would be helpful to hear. Hit subscribe, and most importantly, hey, this is a blatant ask. We appreciate those 5-star reviews, comments, and let us know what you want to hear so we can be there and support you. See you next time.